Hello everyone, my name is Clara Fuchs. I'm a medical doctor and a sports scientist from Austria. 5 million deaths per year are attributed to physical inactivity. Around 40% of long-term chronic diseases could be prevented if the people would follow the recommended physical activity guidelines. And yet, exercise is an underutilized tool and is not prescribed enough in a clinical practice. So why is exercise healthy? Why should we exercise? I think everyone knows that exercise is good for you, right? There are some direct health benefits. For example, it can lower the blood pressure and it can lower the blood triglycerides. There are also some neurocognitive benefits. So it's also very good for concentration and for the mental well-being. So it's also very good for mental health. And it can also prolong the healthy life expectancy, so it prevents a number of diseases and you prolong the healthy life years. Exercise is a cost-effective way to reduce the population morbidity and mortality. The benefits of exercise, especially not just the physical but also the mental and social benefits, should not be underestimated. So our goal would be to teach the patient that exercise can be fun and sustainable in a healthy way.
Cardiovascular disease continues to be a growing issue for the global healthcare community. If we think about current nutritional strategies for the management of cardiovascular disease, both primary and secondary prevention, then there is still this significant level of evidence that aligns the Mediterranean-style diet eating pattern with improved cardiovascular outcomes. But importantly, there are emerging and indeed established diet patterns that still show beneficial value alongside more traditional cardioprotective diets. Things like the portfolio diet and even healthy low carbohydrate diets can effectively manage risk factors for cardiovascular disease. The most important thing with all of these parameters and all of these things to consider is patient choice. And ultimately, patients' decisions and choices need to be informed by robust evidence and crucially supported by that healthcare professional. It's really key to stress the importance of cardioprotective foods. And I say this because there is this growing shift away from what I think is the value that traditional nutritional approaches have to simply now looking at agents for weight loss. People still need to eat. People still need to consume healthy and nutritious foods. And we should be mindful of not just focusing on the role that nutrition has on traditional cardiovascular outcomes like lipids and blood pressure, but also thinking about the role of nutrition on perhaps less well-known cardiovascular outcomes like strength and functionality. And that can be increasingly hard to do if taking anti-obesity medications such as GLP-1 receptor agonists. So there's still a really important role to play from a CVD prevention point of view in patients who are taking those types of medications.
Hello everybody, my name is Claudia Gottbrecht and I'm a psychologist specializing in health and organizational psychology. Today, I'm going to talk about the importance of well-being in clinical care. To explain well-being, I like to use the model championed by Martin Seligman, who used to be the president of the American Psychological Association. According to Seligman, well-being consists of 5 different dimensions that he summarizes in his PERMA model. According to the PERMA model, well-being consists of experiencing positive emotions such as joy or gratitude. The E stands for engagement, which means that you are fully absorbed in whatever it is that you're doing. I also like to explain it as flow. Some people say that they feel like they're fully in the zone, which means that they are fully engaged. The R in the model stands for relationships. That means that you have good relationships with the people surrounding you. Now, when it comes to patients, also consider having good relationships with them, especially if you have patients that may not have close friends or family. You might consider giving them some extra support. The M stands for meaning. That means that you feel like you contribute towards something that is bigger than yourself. For patients, meaning could come from reconnecting with the why behind the recovery. So help them find out why they want to recover. The A stands for accomplishments. That refers to experiencing a sense of mastery or success. While the healthcare profession is inherently meaningful, in the day-to-day hassle, both meaning and accomplishment often go unnoticed. As a very simple technique that I like to encourage healthcare institutions to do, I like to emphasize gratitude walls or thank you walls. So these are walls where you collect thank you letters that you receive from patients. So as you can see, using the Prima model, there are many things that each and every one of you can do to improve your own well-being.
Hi, my name is Nuria, and I am the general manager of Vitalara. We're working across all Europe and states on digital health and implementation of digital health solutions. We are going to see today, which are like the real world implementations of these AI and remote patient solutions. In a very interesting study, also published on the 2025, so this year, our research of German researchers, they analyzed a cohort of 263 patients, and they found three things very, very interesting. They found, or they wanted first to compare if the data that patients are wearing as this kind of wearable data that maybe we can use also could be something similar or some standards to the ECG that they use. They discovered that overall the heart rhythm and the slow changes that these kind of wearables are guiding us as a clinicians or as a healthcare professionals was almost as accurate as the hospital equipment. So this could bring new things to the research. So we can say that some of this heart rate variability data is very similar on the data that we take inside of the hospital equipment. This matter because this kind of solutions can be a great tool for long-term monitoring of these patients and are more and more cheaper and could bring this kind of support at the home of the patients to bring better outcomes for their health. I encourage you to follow all these new developments because I think that we are living in a new era that is going really to improve for better, I think, the health of our lives. So thank you so much.